We're almost in the open enrollment period for marketplace plans. For marketplace plans and those using healthcare.gov, that's healthcare.gov, the open enrollment period is from November 1st to December 15th. However, some states actually have their own individual marketplaces, but don't worry, if this is your first time using healthcare.gov or enrolling in a marketplace plan, if you log on to healthcare.gov, it will redirect you towards your state's individual website, should that be the case. Also remember, if your state has their own website, they may have a slightly different enrollment period. So today we're going to walk you through marketplace plans and healthcare.gov to give you some tips and tricks to make sure you get the best possible plan. Hi there and welcome to our channel. My name is Sarah and I'm here today with iHealthBrokers to go over marketplace plans for 2022. Now at iHealthBrokers, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date. We release videos about health insurance, Medicare, money saving tips, and of course give you healthcare updates. So like I said, please make sure to subscribe and like this video so that we can get this information out there. And if you have any questions, you can reach us here in the comments, or you can give us a call at iHealthBrokers at 888-410-0344. There's absolutely no charge for our services. We're licensed nationwide and with over 200 carriers, so please feel free to give us a call and we're happy to help. And as a reminder, you can find us on Facebook, Twitter, Instagram, and TikTok. And if there are any videos you'd like to see, you can let us know in the comments. All right, let's take a look at healthcare.gov. So here we are on healthcare.gov, that's healthcare.gov. So for healthcare.gov, as of right now, the plans are not actually available for enrollment, but they are available for preview. So that's what we're going to look at today. So we're going to click over here where it says Get Ready to Apply. Now let me take you through some of this information. So we have ways to apply for 2022 health insurance, and that's the first thing that I want to talk about. Because here, if you scroll down, it'll tell you basically these are the ways that you can apply for a marketplace plan. You can find and contact an agent or broker or a sister. You can have an agent or broker contact you. You can use a certified enrollment partner's website. You can, of course, use healthcare.gov. You can also contact the marketplace call center to enroll by phone, or you can fill out and mail in a paper application. So we will come back to this option these two options in just a second. So of course today what we're going to be focusing on is using healthcare.gov to apply, just to at least look at the plans. But if you're somebody that really doesn't care for technology, perhaps you're not too comfortable with computers, then you can actually contact the marketplace directly. So if you were to click this button, basically it'll take you to this page. It'll prompt you to call this phone number, and then someone will be able to help you on the phone. Or you can also fill out and mail in a paper application. This is probably the most complicated way, so we certainly wouldn't recommend this. So if you do want to use an agent or a broker, you just click this button here. You would put in your zip code, a zip code. And here are some agents and brokers in this area. Or, of course, you can call us at iHealthBrokers because we are licensed nationwide. Now, I just have to let you know, you will absolutely not save money by working directly with an agent. An agent is a representative of the carrier, that is to say, the insurance company. There are no discounts or incentives that they can provide you. The rates are set whether you go with an agent or a broker. However, if you go with an agent, you're going to have a little bit more legwork because an agent can only present you with their company, that carrier's plans. If you want to look at other carriers' plans, you'd have to contact a different agent. That's why we recommend working with a broker. An agent works for the carrier, a broker works for you. They're a liaison between you and the carrier, so they can present you with multiple different plans by multiple different carriers. It saves you a lot of legwork. And usually brokers don't charge for their services. Some do. Some will charge you an extra fee, but of course we don't charge an extra service fee. So if you'd like our help, you can reach us at iHealthBrokers at 888-410-0344. Or of course you can go it by yourself and use healthcare.gov. Now let's take a look. We're going to preview 2022 health insurance plans and prices. We're going to click right here, Preview 2022 Plans and Prices. Now here's something important. So over here, I'm going to put in a Florida zip code because Florida uses healthcare.gov. But if I were to put in a different zip code, let's say I wanted to use something for New York, your state's marketplace is New York State of Health, so it would redirect me. That's what I mentioned earlier. So even if you're not certain if you use healthcare.gov or your state has a marketplace, it will redirect you. But let's go back and use a Florida zip code. Okay, so we've entered our zip code. It's going to ask to tell us about you and your household. The reason it asks this is because it's going to determine if you are eligible for those premium tax credits. So of course you can skip these steps, and that will only show you the full price plans, but you do want to try to make yourself eligible for those premium tax credits. So let's click Start. You don't have a plan ID. If you're re-enrolling, then you would put in your plan ID, but we don't have one, so we're going to click Skip. Okay, so let's put you and other people. Are you married? Sure. Will you claim any dependents on your federal tax return? So these would be any of your children. So we will click yes. Let's say we're going to claim 3. Okay, let's say 30, female. We're just going through this really quickly because I'm sure you're not as interested in the made-up personality that I'm inputting. So say 30, female, legal parent, continue. We'll say our spouse is also 30, male, legal parent, continue. Now we're going to talk about our dependents. Let's say our first child is 1, a male, obviously none of these. Our second child is 2, another male, none of these, and 3. All boys, back to back. Then we just take a look at this information, make sure it's correct. This is our made-up scenario, so it's correct. All right, now we're going to estimate our income. This is very tricky because you're estimating it for the upcoming year, and it's very important that you be as accurate as possible. So let's say that we're going to make $75,000. Well, since we've made $75,000 with a 5-person household, we're going to get a premium tax credit. We should be eligible for a premium tax credit, which is indicated right here. So let's take a look at the plans. So this little pop-up, Help Comparing Plans, it'll give you quick definitions, you can filter, and you can select plans to compare. Here are the plan categories. So a lot of people get a little bit confused by the plan categories. It's in bold here. Categories have nothing to do with care quality. That's very important. And the metal tiers are a little bit misleading. There are bronze plans, silver plans, gold plans, and platinum plans. Again, it has nothing to do with the quality of care. It only has to do with the cost share. So basically, a platinum plan, you're going to pay 10% of the costs, and your insurance carrier, the company, will pay 90. Gold, it's an 80-20 split. Silver, it's a 70-30. And bronze is a 60-40. So as you'll notice, the premiums tend to go up, up, up. But that's because your copays with the platinum plan will be very low, and your copays with the bronze plan are going to be higher. And then the silver and gold are somewhere in between. But again, it has nothing to do with the quality of care. A platinum plan doesn't have better doctors, better coverage. It's just the co-share. It's just the co-insurance, the copay. All right, here we go. So I do want to mention right now, due to the American Rescue Plan Act, a lot of the premiums are very, very low. more people are eligible for those premium tax credits than ever before, and the premiums themselves are lower. So you will notice that some plans have a $0 monthly premium. That's not always the case. That is due to the American Rescue Plan Act, and that act is set to expire. However, there is a possibility that it may be extended, possibly indefinitely, which would make healthcare much more affordable for the average American. Anyway, so here are our plans. Right now, it's being filtered by lowest premium. If you wanted it filtered by lowest deductible, of course, you could click that as well. Let's go back to lowest premium. And then based on the income and household size, we're eligible for extra savings with silver plans. So if you specifically wanted to see silver plans, of course, you would just click on that, and it would filter out the bronze, platinum, and gold and show you just silver. I'm going to get rid of that for right now. So let's take a look. So this is the first plan that's offered. Again, it's filtering by premium, so this has a $0 monthly premium. It has a deductible for your family of $12,200. And then let's look over here and see what the plan details are. So here are your deductibles. It is a $6,100 individual deductible, a $12,200 family deductible. So what does that mean? Well, if you as an individual meet $6,100 in medical expenses, then your insurance starts to kick in. However, if your family, let's say you and even just one other person in your family, meets that family deductible of $12,200, then the rest of your family is covered. Basically, the insurance will kick in for the rest of your family. Basically, that family deductible is a good way for larger families to get more bang for their buck with insurance. Here's out-of-pocket maximum. So as an individual, once you've met $8,550 of in-network covered services, which we'll go over in just a minute, then your insurance will take on the remainder of the costs. Again, this is only for in-network covered services. So, for example, a lot of plans, actually all plans, I don't know of any plans, cover things like cosmetic surgery. So if you wanted to get something like that, even if you've met your out-of-pocket maximum, well, that's still going to be something that you're going to have to pay out of pocket. Or if you're choosing to see a doctor that doesn't accept your plan, because this plan is an HMO, which means you need to see doctors and visit hospitals that are in network. Okay, so let's take a look here. Medical providers in network. So if you already have a family doctor that you love and you want to continue to work with that doctor, or there's a specialist that you see for a certain condition, then this is definitely something that you'd want to look into. So you'd go over here, you'd click Add Medical Providers, and then you would put in your doctor to make sure that they accept your plan. Prescription drugs, same thing. If you take prescription drugs regularly, then you would again want to put in that prescription drug to make sure it's covered, see what the costs are, and make sure that this is a plan that's right for your needs. Okay, so let's look here. Star rating, it's just going to give you an indication of what people think of this plan. Plan documents, this is important. Summary of benefits. It's going to take you to a very, very in-depth page. This is explaining what I said before. What is the out-of-pocket limit for this plan? Do you need a referral to see a specialist? Yes, because this is an HMO. And here are your co-pays. So primary care visit to treat an injury or illness, $35 after deductible. Specialist visit, $75 after deductible. Preventative care or screening, no charge. So there are services that are covered. They have those 10 essential benefits, and some of those are covered even before you meet your deductible. So if you're going for routine care, anything like that, preventative care and screenings, then there's not going to be any charge. Here are some more breakdowns of the costs. Diagnostic tests, 50% coinsurance after you've met your deductible. Imaging, 50% coinsurance after you've met your deductible. I won't bore you by going through every single facet of this plan, but basically you get the idea. It's breaking down what your costs might be for prescription drugs. It's breaking down what your costs might be if you have outpatient surgery, if you need immediate medical attention, meaning the ER or urgent care, if you have to have a hospital stay, if you need mental health, behavioral health, or substance abuse services, if you're pregnant. So pregnancy is covered as one of the essential benefits. So for those office visits, there's no charge. You shouldn't be charged until the actual delivery of the child. And so on and so forth. Children's eye exam, no charge. Children's glasses, no charge. Children's dental checkup, not covered. So that would be something you would need to add on if you were interested. I'm going to exit out of this. Access to doctors and hospitals. So you could view the provider directory. National provider network, no. To check if specific doctors or facilities are covered, use the provider search feature, call the health plan, or call the doctor or facility and ask if they accept this coverage. That's very important. Hospital services, we sort of already went over this. Cost and coverage examples. So this is just giving you some average expenses. So typical cost for a healthy pregnancy and normal delivery, because that's that out-of-pocket maximum, right? So you're not going to be charged for those office visits, but then you will have a charge for the actual delivery, but that's only up to the out-of-pocket maximum. Adult dental coverage is not included. Child dental coverage is not included. So if that's something that's important to you, then you would need to add that on or purchase private insurance. So let's go back to the plans. So this plan does include child dental. This is basically a cheat sheet where you can compare deductibles, out-of-pocket maximums, monthly premiums, copays and coinsurance, and possibly some basic plan features. Okay, so now let's look at something maybe on the other end of the spectrum. Let's look here. Let's look at a platinum plan. And this is going to have a much higher monthly premium, but a lower cost share. Let's apply filters. So, much higher monthly premium, that's certainly much higher than zero. However, our deductible is less. And it's only a 10% coinsurance after you meet that deductible. So that is a significant difference. Let's take a look. We've already gone over this, so I'm just going to scroll down again to plan documents. And I want to look here at summary of benefits. It's going to take me to that very detailed page. So the overall deductible, we have lower deductibles. Okay, the out-of-pocket limit for this plan. Now let's scroll down. So for example here, diagnostic work is a $20 copay per visit, as opposed to before we had to meet that deductible and then there was a significant coinsurance there. Let's look at our generic drugs, also much less expensive. This is all our coinsurance, 10%, 10%, 10%. So again, we had a much higher monthly premium, much lower copays. But we still don't have children's dental. I don't believe we had adult dental either. So that's what I'm saying. It doesn't mean that it offers better benefits. It doesn't mean that the plan is a higher quality plan, that you'll have access to better care. It just means that the coinsurance is structured differently. Let's click out of this. I want to go back once more And just take a look. I want to show you the filters again. So I'm going to get rid of this platinum filter here. And there's some other things that you can put in here. So if you already have medical providers that you use, doctor specialists, you can actually filter plan by that. Let's go back. You can also choose whether you want an HMO or an EPO. An HMO, you're going to have a primary care physician. It requires a referral to see a specialist, and you have to use somebody that's in network. An EPO will give you a little bit more flexibility. And you can also put in here if there is a deductible that you feel comfortable with, a premium that you feel comfortable with, to sort of filter those plans. And then the last thing that we're going to talk about is an HSA. So I just want to apply that really quickly and see. So there's 5 plans available that work with an HSA, which is a health savings account. Basically, this is a way to lower your MAGI. It's great. It has that triple tax advantage. So the FIRE community really loves HSAs because basically you're able to lower your MAGI by contributing to your health savings account. Then when you withdraw money from that HSA, as long as it's for a qualified medical expense, that is also tax-free. And the accounts are interest-bearing, and that interest is tax-free. So it's a great sort of financial decision, but you need to make sure that the plan still works for your family because HSAs only work in conjunction with high deductible health plans. Have you noticed that these deductibles are much, much higher? So you have to pay much more out of pocket before your insurance kicks in, for a lack of better words. So is this right for you and your family? Maybe, maybe not. It really depends upon your needs. So I'll leave it up to you to look through your individual state's offerings. But let's just go back because I want to look at one more thing here. So pardon me while we click back. Okay, so I'm back on this page where we're estimating our income. Let's say that our made-up family of 5 is in a much higher income bracket. Uh-oh, we are not eligible for a premium tax credit, which means we're looking at full price plans. So let's take a look. So that plan that was $0 before is now $1,137.86. Now, perhaps if you're in that upper tax bracket, that doesn't really make a difference to you. But if you're sort of on the cusp and you really do need to qualify for those premium tax credits to make the marketplace plans more affordable, then what you need to do is figure out a way to lower your MAGI, which is your modified adjusted gross income. And there are ways that you can do that. Now, there are ways to lower your MAGI, and we have a video dedicated entirely to that, which I will put in the description below. Also, a 1-hour session with an accountant can cost as little as $50, but it could save you thousands of dollars per year in monthly premiums, so it's definitely something worth looking into. You could also consider an HSA to knock a little bit more off your MAGI, but be aware that HSAs only work in conjunction with high deductible health plans. Those are HDHPs, and you want to make sure that a high deductible health plan still is right for you and your family. Estimating your income from the upcoming year can certainly be tricky, especially those that are freelancers, because your income can change year over year. It can change quite dramatically. However, you want to try to be as accurate as possible, because if you underestimate how much you're going to make, making yourself eligible for one of those premium tax credits, and then you end up making more money, you're going to have to pay that tax credit back when it comes time to do your taxes, and that's certainly not a welcome surprise. So I'm going to take you to yet another page on healthcare.gov. Don't worry, I'm going to put a link to this exact page in the description below. But this talks about how to estimate your expected income for the upcoming year, which can certainly be a little bit tricky. So basically, you're going to start with your household's adjusted gross income, which is your AGI. Here's a little pop-up that will tell you more about that. You add the following kinds of income: tax-exempt foreign income, tax-exempt Social Security benefits, including Tier 1 railroad retirement benefits, and tax-exempt interest. But you don't include Social Security income, and you adjust for any changes you expect. Basically, altogether, this is going to give you your MAGI, which is your modified adjusted gross income, not to be confused with your adjusted gross income, although in all honesty, for most people, it's going to be the same. And based on that estimate, that's how healthcare.gov will determine if you are eligible or if you're not eligible for one of those premium tax credits, which can significantly lower your monthly premiums. Also, if there are any changes to your household size, your income, or your location, you want to make sure to update your information on healthcare.gov as soon as possible, because changes like that can affect your monthly premiums. Thanks so much for watching. If you have any questions, you can reach us in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. Health insurance is very confusing, but it's crucial that you pick the right plan for your needs. So we do try to make things a little bit simpler. And as I said earlier, there's absolutely no charge for our services or pressure to buy or enroll in anything, but we are here to answer any questions and hopefully steer you in the right direction. As always, please make sure to like this video so we can get this information out there, and subscribe as well, because we release these videos on a weekly basis. And find us on Facebook, Instagram, TikTok, and Twitter. Thanks so much for watching. Have a great day.